Are you pregnant? Are you worried about the myths and misconceptions surrounding C-section like C-section is easy? You cannot breastfeed after a C-section. You cannot do skin to skin. You cannot hold your baby. You have to be in bed all the time. Let's dive in to see the myths and misconceptions of C-section. Hello everyone, welcome back to Happy Pregnancy with Aarti. This video is a must watch for all the expectant parents out there. I am Aarti Manikandan, mom of two and a Lama certified childbirth educator. I am passionate about educating and empowering pregnant couples from their journey from pregnancy to parenthood for the fourth consecutive year. Most of us don't want a C-section, but being prepared is absolutely necessary. These things which I'm going to share with you today could be surprising to you as a new mom. I'm going to share some information with you as a mom and a Lama's educator who is 4 weeks postpartum today with the emergency C-section. I'm sharing this information about C-section to all the expectant parents out there, hoping that this will be helpful. Also, make sure to watch until the end of the video for the most exciting bonus section. So, what is a C-section? Cesarean section, or commonly called a C-section, is a surgical method used to deliver the baby through an incision in the mother's abdomen and the uterus. According to ACOG, in USA alone, 1 in 3 babies are delivered via cesarean birth. While C-section is performed for medical reasons, it has become a common procedure. There are lots of myths and misconceptions surrounding this procedure. It is essential to dispel these myths to ensure accurate information and understanding. Here are some common myths that are related to C-section. Myth number 1. C-section is easier. Do you think C-section is easy because it avoids labor pain? Do you think C-section is less risky because it is done in a controlled environment? No. C-section is different. It is neither hard nor easier than a vaginal delivery. It is a common misconception that having a C-section means avoiding the pain of labor and having a shortcut to delivery. Yes, you avoid the pain during surgery because of anesthetics. But C-section is a major abdominal procedure which involves a time for recovery. But C-section is type of an abdominal surgery which comes with a period of discomfort and recovery. Even though it is very common, it is not that simple. Once the baby is born, recovering from C-section might take a longer time than a vaginal delivery. Women who have C-section may need to spend 4 to 5 days in the hospital, whereas women who give birth via vaginal delivery are expected to stay 1 or 2 days in the hospital. The recovery from C-section must continue at home and it will take several weeks. C-section is recommended only for medical reasons, but mothers can request a C-section too. If you elect to have a C-section, do understand that C-section comes with several risks too. Cesarean birth increases the risk for the future pregnancies. They include problems with the placenta, rupture of the uterus, and hysterectomy. If you're scared of labor pain, do take a childbirth class to understand what happens during labor and to know about your medical and non-medical pain relief options. If you're interested in having a medical pain relief, do talk to your doctor about it. Myth number 2. You cannot have skin to skin after C-section. Are you expecting mom who wants to hold your baby right after your birth? Are you worried that C-section might hinder your chances of holding your baby right after birth and doing skin to skin? Keep watching. Many women fear that they won't be able to do skin to skin after C-section because they are connected to machines, wearing a hospital gown, or are under anesthesia. But here is the good news for you. Most of the C-sections done nowadays are done using regional anesthetics. So mom is conscious throughout the birth. So almost all mothers can do skin to skin right after birth. Lamas also encourages skin to skin right after birth for both vaginal deliveries and C-section. In fact, in one study done by Lamas International in 2015, among parents who had skin to skin after C-section reported that they had an overall positive birthing experience and they also felt that the baby was secure and safe. So, for people who do not know what a skin to skin is, it means keeping the baby against the bare skin of the mom just with the hat and covered by a blanket on the top. It helps to sustain blood sugar levels and have a good breathing pattern for the baby and also keeps the baby calm. It also helps you bond with your baby. Your body is designed to provide suitable environment for your baby even after birth. If having skin to skin is important for you, do let your care provider know ahead of time. Skin to skin is possible immediately or shortly after birth, even if you have a C-section. Myth number 3. Once a C-section, always a C-section. Did you have a previous C-section and are afraid that you might need to have a C-section again? Are you afraid that you might not have a chance for a vaginal delivery? Keep watching. There is a reason why people used to believe that once you had a C-section, then the subsequent birth has to be a C-section, because it used to be true. Back in the day, all the C-sections are done using a vertical incision that runs from just below the belly button to the top of the pubic bone. This long scar makes labor and delivery dangerous because it increases the chance of uterine rupture. But nowadays, C-sections are done using low, transverse, horizontal incisions. These incisions are very small so that the scar made is very small and are usually just below the bikini line. Not only this means you can generally hide your C-section scar while wearing a bikini, but also it reduces the likelihood of uterine rupture. VBAC, vaginal delivery after C-section, is a term used to deliver the baby vaginally if you had a previous C-section. Whether you want to experience natural birth or want to avoid the complications of multiple C-sections, talk to your care provider about having a TULAC. TULAC means trial of labor after C-section. Your doctor will look at the reasons for your previous C-section and determine if you are an ideal candidate for VBAC. Generally, women without high-risk pregnancies and are in good health are often candidates for VBAC. According to ACOG, women who attempt TULAC have an 80% probability of having a vaginal delivery, that is VBAC. Some of the benefits of VBAC include lower recovery time and also lower risk in the future pregnancies. The chance of uterine rupture in VBAC is still below 1%. You should talk to your care provider about the benefits of VBAC and the risks associated with it. Myth number 4. C-section can be avoided if you just know better. Is there a shortcut to avoid C-section? Do you want to know the reasons of C-section? Let me tell you. In the recent years, new parents are proactively planning for their deliveries. They attend childbirth class, understand the labor process, hire a doula, and also write a birth plan. These things are great to prepare for the delivery. It is true that taking a childbirth class makes you feel empowered and also paves a way for positive childbirth experience. But we need to understand that C-section can also happen at times. Although we expect to have a vaginal delivery, we need to be open-minded about the unpredictable nature of childbirth. Sometimes C-section might be necessary. According to ACOG, the reasons include failure for the labor to progress, baby distress, fetal malpresentation, placenta previa or any other concerns with the placenta, and having more than one baby. Planned C-section might be the safest way to deliver for the moms with high-risk pregnancies. Sometimes they can happen as an emergency C-section for moms in labor where the labor is posing a risk for the due. We need to understand that having a C-section doesn't mean you missed a big part of childbirth. It is just one other way to deliver the baby. You carry the baby for months, give birth, and you're going to care for the newborn. Some women might request C-section with their first babies. They might want to avoid the labor pain or avoid the complications related to vaginal birth, or they even want to plan the time of the delivery. However, according to ACOG, this might not be an option for women who plan to have several pregnancies. The more the C-section the woman has, the greater the risk of problems with future pregnancies. If you have any questions on these, please comment below. Myth number 5. You cannot breastfeed your baby. Do you want to breastfeed your baby? Are you worried that C-section might affect your ability to breastfeed? Don't worry. I have a good news for you. C-section only has a little effect on your ability to nurse your baby. Your breast milk will come in as readily as you would have delivered vaginally. Colostrum begins to secrete as early as 16 weeks into your pregnancy. It is important to begin breastfeeding as soon as possible after the C-section and keep continuing breastfeeding as frequently as possible to ensure a good milk supply. You will probably receive a regional anesthetic like epidural rather than a general anesthesia, which used to make the birth parent unconscious during delivery. Regional anesthetic like epidural blocks pain sensations in the midsection and the legs while keeping the moms awake during the birth and after the birth. These drugs do not seriously affect the infants. Since mom and baby are awake and conscious after childbirth, they can readily breastfeed. Lamas also encourages breastfeeding within 1 hour after childbirth. Myth number 6. You will not feel anything during your surgery. Do you want to know if C-section means completely no pain? Do you want to know what moms feel during the surgery? Keep watching. During C-section with regional anesthesia like epidural, you will never feel pain, but you will feel some sensations during the childbirth. Though it might come as a surprise to many moms that they might feel something during the actual childbirth. Here are some things that you might feel. Many women feel tugging sensation. They might also feel the pressure when the physicians are moving the organs to get the baby out. Most women report that they feel the most tugging during the actual childbirth of the baby. Most of the doctors will warn you before this happens so that you don't feel frightened. You can do relaxation breathing during the short, intense portion of the surgical birth. You might also feel some pressure later on after the birth when the surgeons are stitching up the incisions. Be it epidural or spinal tap, the mothers will be able to feel some sensations few hours after the childbirth. Doctors will prescribe pain-relieving medications for the first few days after childbirth. Myth number 7. You need to be confined to your bed. Should I not get out of the bed? How long do I need someone's help? When can I get back on my feet just to get to the restroom? Keep watching to know answers for these. Though C-section is a major abdominal surgery, it is important to get out of the bed and walk within 24 hours after surgery. This is necessary for effective healing, ease gas pains, prevent blood clots, and help moms have a bowel movement. Even though it is recommended to move, moms might need some help in the initial days of the recovery. You can start doing some gentle exercises a few days after C-section. You can do 2 or 3 slow, deep breaths every half an hour. This can prevent lung congestion by sitting in a bed for longer hours. You can also do shoulder circles. You can sit upright and roll your shoulders 20 times each direction every hour. It can help you with the stiffness. You can also do some gentle stretching by standing against the wall and raising both of your hands above your head. You must feel the muscles in your belly stretch. You can hold this position for 5 seconds and then relax. You can do this up to 10 times a day to boost flexibility around the stitches. Try not to do too much household work or other activities for the first couple of weeks. Check with your care provider before returning to any of these activities. In general, you'll have to wait 4 to 6 weeks before you do any heavy exercises that involve your belly or lifting anything heavier than your baby. Also, you have to wait 2 weeks before you could drive a car, no matter where you are in your pregnancy. If you just found out or you have been pregnant for a while now, you need to know that what you eat is a factor in having a healthy pregnancy. So, in the description, I have a document on the information about nutrition by trimester and balanced diet for pregnancy by Lamas International. I'm sure this is going to be very helpful for you. So, there you have it. Common myths you need to know about C-sections. Attend my childbirth class to know more about pregnancy, childbirth, and even about C-section, breastfeeding, and infant care. If you're interested in joining a Lamas class, do check out my Instagram, happypregnancy_Aarti, for the latest class details. If you want to know how a childbirth class can benefit you, do check out my video on 7 reasons why you should attend a childbirth class. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more pregnancy and parenting content.